Ghana has recorded 14 more cases of the deadly coronavirus since the first 2 tested positive on March 12th, bringing the total number of confirmed cases to 16. With the latest cases including communal infections, calls for enhanced efforts at fighting the pandemic have heightened. Publications by health officials have revealed that 3 of the 5 cases were made up of people who had no travel history or have not been in contact with an infected person. They include the 29-year-old Ghanaian lady who has no history of travel and a 53-year-old Ghanaian male resident in Tema who has no history of travel and no evidence of close contact with a confirmed case. With these increasing numbers, the Ministry of Health says the University of Ghana Medical Center is being prepared as a quarantine center to combat the spread of COVID-19.
This facility has been prepared and they are ready in the event that somebody requires to be brought to an ICU. You know, these things are in grades. Somebody may not require ICU care, right? Usually those who require ICU care are those who are unable to breathe on their own, and that you require ICU and ventilators to help in the breathing of the person, because at that time the virus may have taken over the respiratory system of the person, right? And that is where we require an ICU, because I'm sure when you go to mention to people that they have 16-bed ICU, somebody may think that it is just an ordinary ward. So 16 beds, we can easily get 16 people to occupy it, now that we already have 16 cases.
The GCB Bank has donated 100,000 Ghana cedis to augment government efforts at saving Ghanaians from the life-threatening disease. Expressing appreciation over the gesture, Minister of Health Kweku Agyeman-Manu reiterated the need for all and sundry to comply with the advised preventive measures, as the country has a tendency of recording more cases in the near future.
So over the next few days and weeks, we are anticipating that we're going to have larger numbers of people who are already having the disease. The only thing that I can say now is the fact that we should all be listening to the guidelines and advice that is coming from our professionals and those who are flying our materials and all the radio stations and television stations and people who are discussing COVID-19. We should listen to them and comply with the advice that they are giving to us.
He also expressed government's commitment at supporting persons who cannot afford the cost of undergoing self-quarantine.
But let me advise that if you do not have some very essential things to do in town, please stay at home. We're still getting some of our people coming from outside. They are family people. They are Ghanaians. We can't stop them from coming. But when they come, please, we need to put them into quarantine places. Even if it is your home, let that person stay in one room, feed him for the 14-day period. Government is working so fast to bring in some of the test kits to begin to see how we can manage with these things. Let us get them checked up before they integrate with us. Some people who can afford are renting empty places for their relatives who are coming back so that they can be quarantined. This is what we call self-mandatory quarantine. But the state is making provision to quarantine those of us who cannot afford to put ourselves into quarantine places.
Should Ghana record a critical case of coronavirus, a 16-capacity bed intensive care unit in the University of Ghana Medical Center has been set aside to cater for such cases. Reporting for Citi News, I am Na Adele Moffat.